Hello, future nurse, and welcome to our video lecture series on communicable diseases and infectious diseases. For this video lecture, we are going to talk about one of the most common sporadic diseases, which is rabies. Okay, and I don't know if you have experienced being bitten by a dog, okay, by a pup, but I have my own experience, and unfortunately, the dog died. So, meaning it is rabid. Okay, so let's continue our uh, lecture series. So, rabies is a common has a common synonym of hydrophobia. In some references, it's also called Lysa or Larynge, and the disease is a disease of a lower form of animal and not really of human. Okay, but it is from an animal that is transmitted to humans. Okay, so far, based on my researches, there are no known humans who are rabid in nature. Okay, so this came from canines, and the causative agent is a neurotropic virus, and it has special affinity to the CNS. That's why it's called neurotropic, which is a rhabdovirus, which is usually referred to as a bullet-shaped microorganism. Okay, and as you all know, as being mentioned already, it is coming from a bite of an infected or a rabid animal. So again, not all animals, especially canines, not all of them are rabid or infected. Usually, this is transmitted by infected saliva through bite or wound. Okay, and the brain of that susceptible host is affected if it's not treated or managed early. Okay, and the brain usually is infected, and it has incubation period of 4 days to years to 19 years. So one reference would say depends on the bite site, um, and what's this? It is developing the risk of developing rabies is also uh, dependent on the bite side. Is one reference would say it depends on the proximity to the brain. Okay, if it's in the lower extremity, like it's 10%. The upper extremities, like your arms, it's 15 to 40%. If it's on the face, it's higher, like 60 and above, 60% and above. But rabies, it is 100% fatal. Okay, rabies is 100% fatal. That's why it's really encouraged that you become a responsible pet owner, meaning you really ensure that your pets, especially dogs, are not rabid or really, uh, let me use the term, clean from the virus. One reference, there are from one reference, there are two pathways of the rhabdovirus from the peripheral nerves, from the CNS, and also from the efferent nerves, usually from the salivary gland of an animal. Peripheral nerves of the animal, there is presence of negri bodies, usually found in the brain of the infected animal. These are pathological lesions formed as the microorganism multiplies. Okay? So it's found in the brain of an animal. Mode of transmission, as mentioned several times, is in contact with saliva of a rabid or infected animal. Incubation period, again, it differs. Although one reference would say 1 week to 7.5 months to years. Uh, Again, assist factors on incubation of the virus, again, it has several factors. One is proximity to the brain or distance to the brain of the bite, extensive of the bite, how large or of an area was beaten, the species of the animal, the richness of the nerve supply of the body part beaten, and even the resistance of the host. Okay. For animals, again, there are stages of manifestations. Okay, and it's dumb stage and furious stage. So these are the manifestations that you need to observe to your dog. If you suspect, if you want to know that, or plainly, if you suspect that the dog is rabid or infected. Okay, so dump stage, the pet or the animal is having a complete change in disposition. He it suddenly becomes withdrawn, stays in one corner, became quiet and depressive. Sometimes he becomes hyperactive, walks to and fro, and this is during the manic stage leading to the furious stage. Okay, so easily agitated, bites even without warning, fearful look, drooling of saliva. Animal is expected to die after this exchange of stages. Okay, and for humans, just to take note, if you are beaten, if you were beaten by a dog, by a suspected rabid animal, or any animal for that matter, whether it's infected or not, always the first aid is to wash thoroughly in running water and soap the bite site. Then other references would say go for uh, injection of anti-rabies and anti-tetanus. Then for the dog, observe it for 10 to 14 days. Do not kill the dog. Okay, tie it, or should I say leash the dog. Okay, and observe for 10 to 14 days. If the dog dies, usually the practice before is to cut the head and submit it to laboratories for inspection of the negri bodies. Okay, but you go. I mean, if you suspect that it is rabid, okay, um, go for checkup immediately. See your doctor because time is of the essence. Okay, so whether it's rabid or not, go for a checkup. Okay, so for humans, there are three stages. Incubation period is again, uh, it varies according to references. So I advise you to read other references too. So three stages of manifestations. We have invasive stage. The person may feel numbness on the site of the bite, sore throat, flu-like symptoms, marked insomnia, restless. The person becomes irritable, apprehensive, anxious, with slight photosensitivity and pain at the bite site. So it's whether pain or numbness. Then second stage of manifestations, excitement stage, the person becomes apprehensive, have convulsions, drooling saliva, some phobias like aerophobia, hydrophobia, and the patient fears water, okay, due to experience of laryngospasm. And the patient may have difficulty in swallowing, and in this stage the person may die. Okay, but if it progresses, it has a third stage, which is the paralytic stage. Spasms stops, but paralysis will set in, starting from the toes going up. Okay, and usually this is in minutes only. The patient may become comatose, loss of TGIT control, so incontinence can happen. There will be heart failure, and a circulatory collapse can happen and will lead to death. Okay, I'm not sure if you have seen some video clips of persons who are having the infection, but I suggest you to watch a video clip of persons with rabies, just to see what happens to them. And that's why it is one of really the programs emphasized by the government, that we should all prevent being bitten by animals, especially if it's rabid. And we are asked to raise our awareness on rabies. Okay, and from the manifestations that I've mentioned in the previous slide, death is expected in 24 hours. Okay, from the invasive to paralytic stage. So within a day, the person may die. Okay, and referring to what I am emphasizing about prevention, okay, rabies is preventable but not curable. Okay, once the signs and symptoms appear, especially from the stages, uh, it is already irreversible, and death is again expected to happen. This is an image of a rabid or a rabies infected person. They are usually tied because they are really restless, okay, and really apprehensive. So diagnostic examinations, we have brain biopsy. This is to check if there's presence of negri bodies in the brain of the dog. And we also have direct fluorescent antibody tests. Then observation of dog for 10 days to 14 days or longer if it may be needed, uh, especially if the dog uh, are is dead or with behavior changes. Then management, there are vaccines. There are two types of vaccines administered, although I advise you also to read other references, good resources about the anti-rabies or anti-rabies vaccine. There may be some new forms of vaccines against rabies. Okay, so one is purified verocell vaccine, or the VeroRab. It's administered 0.5 cc per vial in intramuscularly, and on the deltoid muscle or vastus lateralis. Okay, then it has a specific schedule. And the other one is your purified duck and bio vaccine, or Lysavac, 1 cc per vial intradermal, and it also has a different schedule. Passive immunization for immediate effect, meaning we are looking into the use of short acting but fast or rapid effects, because again, time is very important against rabies. Okay, so it should be given up to 7 days after being bitten, otherwise vaccine becomes useless. So earliest possible time. Again, I repeat, time is of the essence. Since a single dose, it is your animal serum, quinimmunoglobulin, and skin testing is done. And human serum, immunoglobulin. This skin testing is not necessary because the source is also from a human. Usually, vaccines, or I should say anti-serums or antitoxins, are tested because they came from other sources. Some came from animals. Okay, nursing care of patients with rabies, provide a dim and quiet environment. This is to prevent stimulation of photophobia. Rooms should be away from utility rooms, especially the washing area, because they are hydrophobic. So they may have change of behavior when they listen or they see or they hear or see fluids or water. That's why in one reference it was also presented that even the IV fluid of a person infected with rabies should be covered with paper. Okay? Restrain the patient even before aggressive behavior sets in. Wear protective barriers on the part of the nurse. Okay, prevention, as I mentioned, it should be um, immunization of animals. All animals should be caged or chained and stay away from stray animals. Here is an example of a anti-rabies prevention um, material, okay, in Tagalog. So it says that if you're bitten by a dog or cat, it should be washed thoroughly, the bite side with soap and clean water. Then go for consultation. Okay, and it is also advised here that you go for um, professionals. Okay, medical professionals. I respect people who go to let me use the word faith healers, but I can say that this professional healthcare providers that we have are also blessed by the Lord to scientifically, okay, diagnose, treat, help you. So go for your medical practitioners. Okay. Then it's also said here that you go and bring your pets to be immunized. Okay. So that would be all for rabies. I hope to see you in the next video lecture. And we have a long list of communicable diseases here. And God bless future nurse. Thank you.